We are so grateful for this opportunity to bring stroke education to the community as well as providers. These films were made possible through a grant from Novo Nordisk to tell a little bit about the work that we do at the Fraser Family Coalition. And today we have with us Dr. Rosenwasser. Dr. Rosenwasser, thank you for being with us. Can you tell us a little bit about what you do and who you are?
Yeah, good morning, Dr. White. Pleasure to be here. And again, thank you for the opportunity to share some information with you. I'm Robert H. Rosenwasser. I'm the chair of the Department of Neurological Surgery, and I'm the president and CEO of the Vicki and Jack Farber Institute for Neuroscience. Stroke and neurovascular care has been really my career and my profession and my research interest and my clinical interest. And this really started with a discussion with Mrs. Fraser, who in the past, about 30 years ago, had been a patient of mine. She makes no secret about it and really is a champion of this as well. And one of the things that we talked about was developing a center or an institute for stroke prevention and aftercare. And, you know, we're in Philadelphia, so an ounce of prevention is worth a pound of cure,
Yes,
right?
it is.
And so we talked about how we could do this, and not only does it have the highest incidence of stroke, diabetes, amputations in the city of Philadelphia due to diabetes, hypertension, stroke, even nationally, it's ranked up there with having the highest incidence of that terrible disease. So anything that can prevent stroke, obviously, it's all the risk factors: diabetes, hypertension, obesity, smoking, and the end point of not taking care of those problems can be a heart attack or a stroke. And so the idea, we talked about how to do this. There was no playbook on how to set something like this up, and Dr. White really wrote the playbook, if you will. It had never been done, and the purpose is really education, right? Education, behavior modification in terms of smoking and eating and control of diabetes and hypertension and all the things that we know are contributors to heart disease, but it's the same markers that are contributors to stroke. And we identified a location after really incredible support. It's a place of learning. It's a place of congregation. As a matter of fact, the program is so successful, we need like a place that's like 10 times bigger than it is, but it's really been a great thing. And, and the first thing was developing trust, right? I mean, people have to trust the doctor. People have to trust medical recommendations. And Dr. White has really gone out in the community, and she has this program with barbershops where they go and check blood pressures and pulse and certain simple things like that and identify problems up. And that program in itself has just been remarkable, absolutely remarkable in identifying the problems. I think that it's really built a tremendous amount of trust in having gentlemen go to the physician to control their blood pressure, to control their glucose, to try to stop smoking, to try to have regular healthy diets. And so it's been a remarkable program. I see the patients after they've had the stroke, but the stroke is the end product of not dealing with all the issues for their lifetime. And again, we talked about it: diabetes, hypertension, smoking, obesity, lipid disorders, etc. So it's been a desire of mine my whole career, and the Fraser Center really is delivering tremendous care and education to really an underserved population.
We're so happy that we're part of the Vicki and Jack Farber Institute for Neuroscience. We feel that that's where we need to be at Fraser. And as you said, we offer diabetes education, diabetes prevention programs. We do stress management. We do medication management, as well as hypertension self-management. And we have an extensive nutrition program. So we're very happy to bring all of these programs and projects to the community under your leadership, of course. And we are so grateful to the Fraser family and the Nicoletti family for their contributions to this work.
And I just want to also say I totally agree with that, because it wouldn't happen without their support, not only financially, but morally and
Yes.
and just keeping us going. But I think that the relationship with Temple is unique.
Yes.
In this arena, we're not competitors. We're working together for a common cause. And it's been a great relationship.
Yes.
And it's really a model for other programs where universities in the same city should have a mission above and beyond their own in giving back to the community. And this is really a very unique program. And our collaboration with Temple has grown into a really remarkable model
Yes.
for other diseases.